Hi everyone, this is Jay from Myofascial, and today we're going to talk about lower back pain. Every other person who come in the clinic, in Myofascial clinic, have a lower back pain. So why so many people have this lower back pain? From my vision, it's most people, it's for the poor postural and specific pattern. Let me explain you. Most problem is coming from the poor posture and unbalanced body. Let me explain you what I mean by that. Most of the people, we do the same movements every day, basic routine. Let's say I'm working in an office and I'm sitting at the desk every day. One group of muscle become really tight, another group of muscle become inhibit. In our case, the lower case, we get it short and tight in the front, and your legs right here in the quadratus muscle will also become really weak in your lumbar area, and glutes has become weak. Just remember, if you have a weak glutes, you're going to have this lower back problem. Weak butt, always trouble for the lower back. This is the golden rule of the life. Remember this. Now, sometimes we have injury and trauma. Our brain been built like that, not put the stress and pressure and pain down, not feel the pain in this area you've been injured. So what's happening with the brain starts shifted the weight to the other side to compensate. And after you do rehab, if you do rehab, body still stay in this position. They shift a little bit back more, but most weight in another side. So you need to do rehab, you need to do specific exercise to shift that weight back and balance your body. This is the key. This is the key of pain-free movements and pain-free life. Now we're going to talk about lower back pain, and we show you what Myofascial can do for you to help you to maintain your lower back. So as I said, we have two ilium and sacrum. Between that ilium and sacrum, we have an SI joint, which is really important to maintain and make that balance leveled, because we have a lot of rotation, we have an elevation, because let's say we're sitting, we lay on one side from one side to another, create that unbalance in your sacroiliac base. This is really important. And of course, we can damage the spine, we can create the bulge disc, herniation, so we need to be really careful. SI joints, don't do any movements which is going to twist and lift. A lot of people lift from the ground with banding, and that's not a good idea. They try to shift it, big mistake, big common injury. So stay away from this movement, make sure you're squatting and you lift it up. Okay, you ready? Let's go to our client and show you what we can do. I'm just gonna work on your left side and see the difference on the both side. If you're spasmatic all the time on this lower back, it's not great. It's not great. You experience the pain every minute. This is not good. You can create, you can do anything with it when you experience pain. So please take care of your body. Take care of these small things. But trust me, small things become big problems. Chronic pain, people come when it's too late. We can't even do anything about it. And that's really sad, because they think it's like us unprofessional something, but it's not. It's because too late. Okay, so now lower back pain, we've been talking about this rotation. For the camera purpose, I will show you how we do it from this side. But Andrew needs to be crooked to the other side. Shifted to the other side. What I'm doing here, we place arm on that sacroiliac joints right in here. Make sure is any pain. No. You can test it before. You can cut a springing. If person have a pain, this is not a good sign. Now, I'm gonna ask my patient to lift this hip up and grab that front ilium, okay? Very careful, very gentle, without any hook, just straight arm. Let it go, relax. You see, he's guarding, he's trying to help me. So now what I'm doing, I'm slowly start shifting I pull with my left and push with my right. I create that counter force and create that shifting. You see what I'm doing? What I try to do here? I'm trying to stretch one muscle and activate. He's going to activate now. I'm going to ask him to push gently, push down towards the floor. And let it go, okay? And I'll show you how it shifted right away. So push it forward and let it go. Okay? Now take a look. You see what I did? He's completely shifted to the right now. You can see this on the camera. So with this shift, just 30 seconds, just take a look how I shifted more to the right. Now I have to go redo it left side. Like I said, I just did this for the camera purpose, but I'm supposed to do from the left side to the right. Let me do it again and see. So as you can see, just 1 minute ago it was to the right, shifted to the right. Now it's more like a neutral, actually more to the left. And what I'm seeing right there, the two spots, almost in his glute, right in here. You can see it right in here. Okay, we need to correct that and see if we can take care of this. See how muscle more relaxed now? We need to activate glutes. And of course, give him some homework, because whatever we've done here, if person is not going to do any muscle activation, is not any correction, it's going to go back again, because we go back to the pattern. We go back to the metrics, mentally, physically. This is better on this side now. But what we're doing right now, we try to activate a muscle. Andrew, what I'm going to do right now, I'm going to place my arm on your lower back. I already did. Now what I want you to do, you want to start shifting your hip forward and backward. You do like a humping exercise, okay? Okay. So go ahead, tilt your forward, and backward. Here we go, very slowly. I want you to breathe with that. Take a deep breath. Slowly, 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 and try to back up. And you see he's really, oh, here we go. How's it feel up there? Yes. You feel that? Something. Yes. This is like shifted, and that's what we've been talking about on this left side. Have something shifted up there. He's activated his muscle. Now everything is worked correctly. And let it go. Try to do it again. Very slowly. How's it feel? Good. Excellent. Okay, and let it go. Let it go. Okay, see the difference. See the difference before and after.